Hello, global citizens. It's October, and I didn't really realize it, but I love October. I love when the leaves change color. Ooh, I love when the crispy leaves fall on the ground and I get to stomp on them. Layering, obviously Halloween. I love dressing up. What else do I love?
Pumpkin spice latte?
No, I do not like pumpkin spice lattes. Those things are terrible for you. There's like 50 grams of sugar or something, which actually leads me to my next point. I love that this month is Health Month at Global Citizen. I'm going to combine two things that I really love, Halloween and health, for 5 scary things that you need to know about health. Number 1. In low-income countries, nearly 4 in every 10 deaths are among children under 15 years old. Let me put this into perspective. I have a group of friends of about 10, and that means that by the time we were in high school, 4 of us would have died. For children under 5, the biggest killers are pneumonia and diarrhea. I mean, who hasn't had diarrhea? But for these children, it's deadly. But there are things that can help. Getting vaccines, clean water and sanitation, adequate nutrition, and breastfeeding. There are all sorts of cultural myths and reasons why women feel uncomfortable breastfeeding, but it's actually really, really important. Okay, number 2. Globally, 1 in 5 children still do not receive routine life-saving immunizations. An estimated 1.5 million children still die each year of diseases that could be prevented by vaccines that already exist. This isn't just designated to specific countries either. Europe just saw its first polio outbreak in 5 years because children aren't properly immunized. And the same thing happened in the US with measles. The outbreak was linked to Disneyland. Ew. Number 3. I have to read this actually. This is from the World Health Organization. Preliminary results of a study show that some men still produce semen samples that test positive for Ebola virus 9 months after onset of symptoms. So now there are more than 8,000 Ebola survivors in West Africa who need to make sure the Ebola virus isn't in their semen. Ugh. And remember, Ebola has killed more than 11,000 people in West Africa. Number 4. 1 in 4 people in the world will be affected by mental disorders at some point in their lives. Okay, but that's not the scary part. What's scary is that health systems haven't responded to the burden of these disorders. In low and middle income countries, between 76 and 85% of people with mental disorders receive no treatment for the disorders. And in high income countries, between 35 and 50% of people with mental disorders are in the same exact situation. Number 5. 2 words, antibiotic resistance. This is terrifying. When I think about the end of humanity, I don't think about robots, I don't think about nuclear war, I think about antibiotic resistance. And there are a couple of key causes. One of them is being prescribed antibiotics without identifying the actual bacteria in your body. The other is that farmers are giving too many antibiotics to livestock just to get them fat. This is horrible. What's really scary is that we've been using antibiotics for less than 100 years and nature is already starting to fight back. When you take an antibiotic, remember that you are affecting other people. So try to use them as little as possible and reserve them for the people who need them, like people who are in life-threatening situations. And also look to natural remedies. I just read that if you have strep throat, you can use apple cider vinegar to cure it, which is crazy because apple cider vinegar can also be put on your hair, it can be put on your skin. It's seriously a miracle item. And of course, take the proper precautions to prevent disease. Stay healthy, global citizens, and enjoy your October. But if you really want to enjoy it, subscribe to our YouTube channel. Click right here.